Okay, it is 12:01 on Thursday, May 8th here in Chicago, and this is Skilled Nursing News Demo Day presented by Vios Medical. My name is Matt Lindner. I'm the marketing manager for WTWH Healthcare, but you guys are not here to hear from me. You are here to hear from Team Vios Medical. So without further ado, I'm going to toss things over to Joanne Yao and Drew Harden. Joanne and Drew, take it away.
Thank you, Matt. And hi, everybody. Welcome to the Vios Medical live demo and case studies. My name is Joanne Yao, and I am the Vice President of Marketing with Vios Medical, and I am accompanied today by Drew Harden, the Vice President of Sales and Customer Success. During today's webinar, we are going to provide a brief background about the benefits of continuous vital signs monitoring. Drew's going to provide an overview of the Vios solution as well as a live demo, and then we'll finish with a couple of case studies, making sure that we leave plenty of time for questions. Please feel free to ask any questions using the Q&A button on your screen at any time, and we will make sure to take the time to answer them today. So as we dive in here, we wanted to talk a little bit about the hospital readmissions challenge. I think we all know that with the trends that we're seeing in the post-acute care market, with residents being discharged at older age with multiple comorbidities, research is showing that about 1 in 4 of these residents will be readmitted to a hospital within 30 days. Of course, these readmissions are costly and disruptive to residents and the facilities, and residents benefit from staying in place as long as possible. The good news is that data shows 3/4 of readmissions are avoidable for common reasons that are addressable. So when we talk about, a high-risk resident, what we mean is that residents that are at risk for readmission with pre-existing cardiopulmonary conditions, such as cardiac surgery, heart failure, COPD, these are the patients that are most likely to benefit from continuous vital signs monitoring. And the good news is that vital signs can help. When you consider vital signs like heart rate, respiratory rate, and SpO2, these are important indicators of acute changes that could require attention. But the challenge, of course, is identifying changes that are differentiating between changes that are maybe just a blip versus actual events that require clinician attention. Now, of course, nursing teams are focused on caring for many residents and don't necessarily have the bandwidth to continually check all residents and respond to events. And that's where new technology comes in to help on-site care teams monitor more residents more efficiently. So we wanted to talk about some of the new technologies that are designed for post-acute care facilities today. And they're not all the same. Now, of course, there's connected spot check vitals. These can definitely help with data entry errors, but still require nursing time to take manual vital signs on a regular basis. Contactless monitoring using radar technology. Now that's being used by many facilities, but still there's limited tracking and it does require nursing time to provide oversight. And of course, continuous monitoring with the remote monitoring service, which is what Vios Medical offers, it does provide that full assessment of cardiovascular and pulmonary condition, along with 24/7 oversight from trained telemetry technicians to identify alarms and important alarms, and then alert your on-site care teams, therefore alleviating the monitoring burden on staff so that they can address real events as they arise. Vios Medical has experience deploying these solutions in post-acute care facilities around the country. And many of these facilities are using the continuous vital signs monitoring service already. And these are some of the benefits that they have told us their nurses, residents, and are giving them feedback on the benefits they're seeing. So first is safety. Second is happy and satisfaction. Nurses, residents, families are expressing that they're happier, knowing that the monitoring is occurring and that they're getting greater safety as well. Now, we do have one of our facilities that did track and report a 40% reduction in readmissions within 6 months of deploying the Vios monitoring system. And that, of course, is resulting in increased length of stay for those residents so that those residents are getting the benefit of more time in the post-acute care facility. So that gives you a brief overview of the background of how continuous vital signs monitoring is being used in real-world practice and benefiting facilities and care teams. And now I will hand it off to Drew to provide you a demo of the system and discuss some of his experience implementing it in practice.
Thank you, Joanne. So now that we've kind of talked a little bit about the benefits and what we're trying to help you achieve, we'll tell you how we're going to do it. So the Vios monitoring system is really made up of 3 components. The first you'll see on the left is the wireless chest sensor. In the middle is the bedside monitor and this central station. And then we wrap our technology in a service that we call remote monitoring, but it's a 24/7, 365 trained technicians that are watching your patients and residents continuously around the clock. Next slide, please. The chest sensor, we purposely designed this to be a comfortable, wearable form factor. We recognize that the residents, we want them to be able to get up and toilet, to ambulate, and most importantly, to be able to go to rehab. They can go to social events, they can go to the dining halls, whatever it is that you would like them to do while they're staying in the facility on their road to recovery, they'll be able to do it with Vios. So it gets stuck on the chest with regular hospital electrodes. You can kind of see where the leads are placed. It's under the blouse or under the t-shirt. So it's unobtrusive, it's comfortable, where it weighs less than 4 ounces. One of the purposeful designs was to use proprietary, non-proprietary, off-the-shelf, inexpensive components as well. And once placed on the patient, you will see 7 leads of ECG. You'll have arrhythmia and pacemaker pulse detection, heart rate, SpO2, pulse rate, respiratory rate, and resonant posture. So we have a built-in accelerometer to the device. So if you think pressure injury and pressure ulcer management or prevention, we could actually tell you exactly how your resident is positioned in their bed. If they've been turned, if they have a turn order in place, we can augment your staff's vigilance to make sure that they do get turned in time to prevent pressure injuries. And then it's a scalable or adaptable acuity. So for example, the SpO2 sensor, if your resident either A, is not indicated for continuous pulse oximetry or won't tolerate having the SpO2 sensor on their finger, you simply can plug it into the device when you need to do spot checks or if you wanted to do it for short-term monitoring, and it's an auto plug and play. So everything's very intuitive, very easy for the clinicians to place on the patient and to manage during their stay. Next slide, please. So recognizing that the care is distributed, we wanted to make sure that when the care team is at the bedside, that they're actually able to see the resident's vital signs. So at the bottom left, you'll see what we call the bedside monitor. It's a tablet and it's going to display 2 waveforms. So it could be ECG and SpO2, 2 leads of ECG, whatever it is, it's completely customizable. You'll see all their vitals. So when the physicians or nurse practitioners, respiratory therapists, whoever is in the room and is interacting or rounding on that resident, they'll be able to see in real time the resident's vital signs. One of the important things that it's been told to us is that a lot of times the residents experience anxiety, and it could manifest itself in a shortness of breath or some chest pain, and giving the care teams the ability to actually see the underlying vital signs continuously, including the electrocardiograph, that can help them ease the anxiety and not unnecessarily escalate care or result in a unplanned readmission. One of the other benefits is that when the rehabilitation team is working with the resident, they can actually see the vital signs under exertion, and they could customize the rigor of the therapy to make sure that they're not overexerting and decompensating. And then from a design standpoint, in the event that there is a power outage or Wi-Fi outage, the system is self-contained, so it will still allow you to monitor the residents continuously to keep them safe until the power or the internet is restored. Next slide, please. So one of the greatest benefits of our system is we recognize that the staff that is providing care, they have a lot of residents. So they are doing med passes and nutrition and all kinds of care activities. So asking them to sit in front of a screen and to have the training and the ability to interpret ECGs it's really non-tenable. So we will provide that service for you to remove that burden from the bedside care team. So we often say, just place the device on the resident for us, and then we will do the heavy lifting. So our trained technicians, they're going to be watching them, as mentioned, 24/7, 365. They'll do the interpretation. They'll generate the reports. But most importantly, they're going to disposition these alarms to make sure that when we escalate this to the bedside, which we follow a pre-approved plan, so we could call the nursing station, call a clinician-carried phone, escalate to a house supervisor if it's an emergency situation, that when that phone rings, we're going to give a very basic report to the bedside team, and then they're going to follow their protocols for responding to the resident's bedside, contacting the physician for medication changes, whatever it may be. But they do not have to listen to nuisance alarms or deal with the burden of monitoring these patients. We will do that for them. So this time I'm going to transition to a live demo and just show you what the central station would be. So again, this would be visible to the care team in the facility, and this is what the remote monitoring technicians will be watching as well. So on the central station monitor, the first view you'll see is what we call the tile view. So all residents that are being continuously monitored will be viewed here. You can see the resident's room, the first name and last name, the demographics. I'll point out one icon. So we do have pacemaker pulse detection. A lot of the residents that we are monitoring have an implant or a defibrillator, and it is denoted by the pacemaker icon. But more importantly, it actually will show the pacemaker pulse detection. It's extremely helpful. We've helped facilities where a pacemaker was not performing to the specification. They were able to get the pacemaker rep into the building and query it and reprogram it and to prevent it a readmission. So this is an important feature. Then you'll see heart rates, SpO2 values, respiratory rates, etc. You'll see this little icon here, which is showing the patient's position and how long they've been in that position. By simply clicking on the tile, you move into what we call patient detail mode. This is going to mirror the bedside monitor, and we did that on purpose so that the UI and the orientation is very familiar to the caregivers, regardless of the location. In this view, you can see three waveforms. So in this particular scenario, we have two ECG and the SpO2 waveform. Again, you'll see all the vital signs, and you'll also see the alarm settings. So it's completely customizable. We do protect the residents and protect the facility at the server level, but the care teams, in conjunction with the physicians, have the ability to modify the alarms to be specific for that resident's care, so that you don't have to propagate alarms and results in additional phone calls. There's really only three icons that you'll use. So the middle one is called review mode. So from the moment the resident is placed on our system, we are archiving and cataloging all their ECG data and all their vital signs data. And any alert or alarm that occurred is easily viewable over here on the left-hand side. So just for example, this high heart rate, If I click on that, it'll bring me right to that point in time where there was a tachycardic event. The monitor technicians will be able to create reports. They'll have the reports ready that could be uploaded if you are a point-click care customer. All the data that we have, we receive the resident information upon admission, and then we also send the vital signs data, and the reports can be uploaded automatically to the patient's record in point-click care. We have additional advanced features, and this is what would be used by oftentimes the physicians when they do their rounding and when they come to the buildings. And of course, our monitor technicians would use this. But anytime there is an event, and oftentimes these are maybe transient events, so a new onset AFib, we will allow them to go and find these onset and offset times. So for example, the patient here transition into this rapid heart rate. They could see this very clearly, document that. They'll give that report to the bedside team, who can then get with the physician, and they could treat the resident accordingly. With that, I'm going to stop sharing, and I'll give the screen back to Joanne.
Thank you, Drew. Really appreciate the live demo and reviewing the Vios monitoring system and how it works with the group. And as mentioned, Drew and his team have experience delivering this solution with many facilities nationwide. And as part of delivering the system, it's not just about the technology, it's about the partnership. And part of making these solutions successful is the education that we provide, that we give 24/7, 365 support and dedicated training. And no facility is the same, so our implementation is custom tailored to each facility. And of course, all of the technology that Drew reviewed, it runs on existing IT infrastructure. So it saves the time of running cables to get this level of monitoring. It runs on existing infrastructure. So we'd love to next go through a couple case reports of how this technology has benefited residents in real world clinical practice. So our first case report here is a pretty it's a pretty substantial report. It might not be exactly the type of thing many facilities experience, but it is the type of activity that the Vios system can help support. So in this case, we had a resident who was a 77-year-old female, and she was admitted to the nursing facility with pneumonia and a confirmed cardiac history with multiple comorbidities. She showed sinus tachycardia with a consistent heart rate around 110 beats per minute. Now there was a clinical event, and this patient was placed on the Vios monitoring system. Overnight, the resident converted into unprecipitated supraventricular tachycardia, and her heart rate increased to 176 beats per minute. And of course, it persisted and then further converted into onset atrial fibrillation with rapid ventricular response. So if you think about what would happen in your facility today, what would normally happen to a resident who went into this type of cardiac event? Well, with the Vios monitoring system, the remote monitoring technicians, of course, reviewed and confirmed the alarms for high heart rate and contacted the bedside nurse, as well as when the patient converted into atrial fibrillation, they made a second call to alert the bedside nurse. The on-site care team was then able to call the on-call cardiology team, who ordered medications to treat these cardiac conditions, and having the resident's heart rate reduce to the low 80s. As a result, the resident remained in place and was able to avoid transfer to the emergency room. So we recognize that this is a pretty substantial type of case to treat and place a patient going into SVT and AF, but probably the type of the type of experience many of you are seeing on a regular basis in your facilities, that's probably happening on a regular basis, that would is kind of closer to what you might experience, is a resident going into bradycardia. Now, in this case, this patient is an 80-year-old male with a diagnosis of chronic kidney disease, as well as a long history of cardiac disease. This patient's on beta blockers to control acute episodes of ventricular tachycardia and was recently discharged from an acute care hospital on a Friday afternoon. Within 24 hours of admission into the post-acute care facility, this patient's heart rate decreased to 43 beats per minute. Now, in this scenario, the Vios monitoring system alarmed for a low heart rate, and the remote monitoring technician did pick up the alarm, verified it, and called the bedside nurse. The nurse then contacted the on-call cardiology team, which ordered a hold of the beta blocker and then adjusted the dose as well, and the resident was able to recover and avoid a return to acute care. So, in summary, if we look at the benefits of the Vios monitoring system in the post-acute care facilities, we know that hospital readmissions are costly, disruptive to residents, and often avoidable. That continuous monitoring for cardiac and pulmonary events enables timely intervention and helps avoid hospital readmission. And real-world experience with the Vios monitoring system shows a tangible clinical, operational, and financial benefit that has resulted in positive ROI for facilities that have implemented this solution. So with that, I would welcome Drew to join me again on camera as we review some of the questions. So if you'd like to submit a question, please go ahead and use the Q&A button on your screen. But Drew, thank you again for the demo. And I know that you have personal experience implementing this solution with many facilities. And earlier we saw that one of the facilities experienced a 40% reduction in hospital readmissions within 6 months of deploying the Vios system. Can you tell us more about how they used Vios, which residents they monitored, and how they integrated Vios into workflows to achieve those results?
Sure, absolutely. The building identified a need for continuous monitoring on their subacute unit. So as mentioned earlier in the presentation, a lot of their resident admissions, they were presenting with multiple comorbidities, and the traditional spot check monitoring often left gaps in care. So if you're only getting vital signs 2 or 3 times a day, a lot can happen to these residents in between those measurements. By deploying the Vios monitoring system, they work closely with the medical team, the clinical and executive team. It is absolutely an organizational initiative, and all 3 of the stakeholders came together. With our assistance, they created a policy and procedure to help risk stratify the residents. This is not, I think it's probably important to be clear that we're not saying that every resident in the post-acute care facility would require the Vios monitoring system, but by working through the policy and procedure, they were able to identify those at risk by stratifying them and then admitting them to the Vios system. Oftentimes, they're going to use this for maybe the first 24 to 48 hours after admission, so they can establish their own baseline, understand exactly what is happening with the resident. As one of those case studies showed, that oftentimes just completed an acute hospital stay. They have new medications on board, and they are transferred over in that Friday afternoon. So for these facilities, the first 24 to 48 hours are critical for them. So they would monitor them. If they're stable, they'll discontinue the Vios monitoring, and then they could clean it and move it to the next resident. This particular building, they started with 4 Vios systems. They quickly expanded to 6 Vios systems. And in doing so, they were able to put the Vios on a lot of these residents and had some very good clinical interventions. And it really helped the physicians work close with the bedside team to modify the care delivery model in this facility, which resulted in a significant reduction in hospital readmissions.
Thank you. Yeah, that's a wonderful real world experience of a facility that implemented the solution really effectively and benefited their residents and their teams. Now, if there's a facility that's considering adopting this technology and they have to consider, there's kind of one system per patient being used, how do they go about the process of determining how many monitors they might need to serve their population?
Yeah, so typically one of the first things we'll do is we'll engage with the executive, the clinical and medical leadership, and look at the average daily census on what they would categorize in their own description as those high acuity at-risk residents. So depending on the census, and we often do promote to start small. This may be a little intimidating to a lot of the post-acute healthcare facilities. Oftentimes they say that, well, we can't do this, or maybe our residents aren't sick enough, but it's really not the case. This can and will work in most of these facilities, and through our program and engagement, one of the first things is we want to identify, what is the right number of units. We can't help you save lives if the devices are in the corner collecting dust, but we also want to be cognizant, and we don't want to put a whole bunch of devices on site that are not going to get used. So by having those discussions, we land on a starting point based on average daily census and the case acuity mix. And we start there. We prove it out inside those four walls of that facility with their nurses and their doctors and their leadership. And once the results are proven, that's oftentimes when you see that the physicians are asking for more devices. The nurses really start to rely heavily on the Vios system to be their eyes and ears when he or she cannot be at the bedside. And as we all know, in post-acute, oftentimes there's high resident to staff ratios. Maybe there's 18 to 24 these residents, and they all require high levels of care. So they know they cannot be at the bedside of a particular resident, but with Vios, they have that comfort to know that somebody is watching them for them. And if something happens, they would be notified so they can get to the bedside.
Awesome. Thank you, Drew. Really appreciate you sharing your expertise and real world experience. For any of you who have had a chance to learn more about our system and would like to kind of keep in touch with us, you can find us and reach out via viosmedical.com. We're also on LinkedIn, so go ahead and follow us for news and updates, and we look forward to hearing from you soon. So thank you, Drew, and thank you, Matt.
Thank you, Team Vios. Appreciate it. That was very informative. I learned a lot today, and I appreciate you guys taking us through that. Thank you so much. Have a great Thursday, everybody.
Thanks.